Welcome. This is where we simplify anatomy, and here we also learn anatomy with so much fun. Let's look at the anatomy of the heart. In this lecture, we'll be unfolding the basis behind the structural configuration of the heart. The heart is a muscular organ that is located at the center of the thoracic cavity. The sole function of the heart is to help pump blood. The size of the heart is about the size of a closed fist. It weighs between 250 to 350 grams in adults, although this may vary with subjects. The heart has an apex and also a base. The apex of the heart is formed by the left ventricle, and this is directed towards the left side of the thoracic cavity. So this is the apex at this region. It is solely formed by the left ventricle. The base is formed up here. It is formed mainly by the left atrium and also some part of the right atrium. So you have the right atrium here, you have the left atrium here, but the base is formed mainly by the left atrium and also a portion of the right atrium. The base of the heart is directed posteriorly. So let's look at the surfaces and the borders of the heart. The heart has 5 surfaces. So we have the posterior surface that's also referred to as the base. So you see it at the posterior part. We have the anterior surface, which is the sternocostal surface. This surface is where the heart is related with the anterior thoracic wall. We have the diaphragmatic surface, which is at the inferior part. And this surface is where the heart is related with the diaphragm. Then we have the right and left pulmonary surfaces. The right and left pulmonary surfaces are the surfaces through which the heart is related to the lungs. Pulmo means lungs, because we know that the heart is located between the 2 lungs at the central part of the thoracic cavity. So the surfaces at this region and also at this region where they are related with the lungs is called the pulmonary surfaces. So those are the surfaces of the heart. Then talking about the borders, we have 4 borders. We have the superior border, which as the name implies is at the upper part. Remember we said that this is the right atrium, this is the left atrium. The superior border is formed by the right and the left atria. And we also have the emergence of the great vessels around the superior border of the heart. And this includes the pulmonary artery and also the aorta. So this is the superior border highlighted in black. Then below this region, we have the inferior border, and this is the inferior border. The inferior border is formed by the right and the left ventricle. Remember that the ventricles are seen in the lower region of the heart. So they form the inferior border of the heart. We have the right border. The right border is formed mainly by the right atrium. This is the right atrium, and this forms the right border of the heart, and this is highlighted in yellow. On the left side, we have the left border, which is highlighted in blue, and this is formed mainly by the left ventricle and also portion of the left atrium. This is the left atrium here, and this is the left ventricle. So it is formed mainly by the left ventricle and also region of the left atrium. So that is how we have the borders of the heart being established. Specific location of the heart. We already said that the heart is located between the 2 lungs. This is the entire configuration of the thoracic cavity. On the right side, we have the right lung. On the left side, we have the left lung. And because they are located on the lateral region of the thoracic cavity, this tends to leave a space at the central part of the thoracic cavity, and this region is what is termed the mediastinum. If you've not checked out my lecture on the mediastinum, please kindly go and do so to update yourself. We know that the mediastinum is further divided into the superior mediastinum and inferior mediastinum, while the inferior mediastinum is further subdivided into the anterior, middle, and posterior mediastinum. The specific location of the heart is the middle mediastinum, which is a portion of the inferior mediastinum. So the heart is specifically located in the middle mediastinum between the 2 lungs. And of course, the heart is enclosed by a double-layered membrane that is called the pericardium. So what is the heart made up of? The heart is made up of muscle, and it is made up of a specialized type of muscle that is called the cardiac muscle. The cardiac muscle is an involuntary type of muscle, which means that you cannot control their action. So we cannot decide and say that we want the heart to contract or relax because it is beyond our will. So they are involuntary type of muscle. They are also striated type of muscle. And this is the cardiac muscle that the heart is made up of. This muscle has the characteristics to contract, and this contraction helps it to execute its function because it's able to pump blood out to supply the different organs in the body. So let's look at the functions of the heart. The functions of the heart can be subdivided into two. We already know that the heart is responsible for pumping blood, but pumping what type of blood and what region of the body is the heart pumping the blood to? We'll first look at the pumping heart mechanism. So the heart pumps out two types of blood. It pumps out deoxygenated blood and also oxygenated blood. So let's first look at the heart pumping deoxygenated blood. This is the lungs in this region. And we know that in the lungs is where we have the air that will be used to oxygenate the blood. It's also been established that the right side of the heart is filled with deoxygenated blood, while on the left side we have oxygenated blood. So the deoxygenated blood on the right side will be taken up by the pulmonary artery, which is the only artery that carries deoxygenated blood. We know that arteries carry oxygenated blood, except the pulmonary artery, which carries deoxygenated blood. So it takes this deoxygenated blood to the lungs where it will be oxygenated. So this is the heart pumping out deoxygenated blood through the pulmonary artery to the lungs for it to be oxygenated. That is an aspect of pumping out blood. The other aspect of pumping out blood is the heart pumping out oxygenated blood. We already established that the right side we have deoxygenated blood, on the left side we have oxygenated blood that is ready to be pumped out to different body organs for it to undergo its metabolic activity. So on the left side, we have oxygenated blood, and this is taken up specifically in the left ventricle, and this is taken up by the aorta, which is the largest artery in the body, and this is the aorta through which oxygenated blood is being taken out of the heart for it to be supplied to the different structures or organs in the body with oxygen and nutrient. So this is the heart pumping out blood. We also have the heart receiving blood from the different body organs. So let's look at this part. And the first region will be in the right atrium. We already established that the right side we have deoxygenated blood. But this deoxygenated blood, where is it coming from? It is coming from the venous blood, and you have this being carried by the vena cava, which is the largest vein in the body. They carry deoxygenated blood from the body organs, and they are released or emptied into the right atrium. The vena cava will receive blood from the superior vena cava. This is superior vena cava, which collects all venous blood from the upper part of the body, and we have the inferior vena cava below, which receives venous blood from the lower part of the body. The superior and the inferior vena cava will merge to form the vena cava, and the vena cava will finally empty deoxygenated blood into the right atrium. So this is the region that receives deoxygenated blood from the body. This is not pumping out, but receiving in this regard. So you can see that the heart pumps out, it also receives. Then we also have another region of the heart where oxygenated blood is being received. Remember, we talked about deoxygenated blood being in the right side of the heart and being taken up by the pulmonary artery to the lungs where it will be oxygenated. After it is being oxygenated, it will be taken back into the heart through the pulmonary vein. We also know that all veins carry deoxygenated blood except the pulmonary vein that carries oxygenated blood. So the pulmonary vein will then carry blood that is oxygenated from the lungs, and it takes it back into the heart. And the specific region of the heart where it is taking this oxygenated blood into is in the left atrium. So you have it in the left atrium, and this is then pushed down to the left ventricle. From the left ventricle, the oxygenated blood is then taken by the aorta to be supplied to different regions of the body. But you see that in the left atrium, we have oxygenated blood being received into the heart. So we say that the heart is known as a pumping organ. It helps to pump blood out either to the lungs where it will be oxygenated, or through the aorta where it will supply the different organs in the body with oxygen and nutrient. It also creates an avenue through which deoxygenated blood and also oxygenated blood are also received into the heart. So let's look at the atria versus the ventricle. We already know that the upper part of the heart are the atria, and also the lower part we have the ventricle. The right and the left atria are thick-walled and are smaller. If you look at this configuration, you see that the right atrium is a small portion of the heart. Also, the left atrium is a small portion of the heart. What these regions are known for is to receive blood into the heart, and it comes at free will because the right atrium receives blood from the vena cava. The left atrium receives blood from the pulmonary vein. So it comes at free will. So the atria needs not to be muscular for it to be able to accept blood into it. And that is why you see that they are thin-walled and they are also smaller. And they are seen at the upper part of the heart as we've established. And this is the pattern by which blood flows through the right atrium, and also the pattern by which blood flows into the left atrium. So this is the right atrium and this is the left atrium. So this structure, you see that they are small if you compare it with the general configuration of the different regions of the heart. And this, of course, is different from what is presented around the ventricular region. In the lower part, we have the right ventricle and the left ventricle. The ventricles are responsible for pumping out blood. It helps to pump blood out through the pulmonary artery to the lungs where it will be oxygenated. For the left ventricle, it helps to pump blood into the aorta where it will be distributed to different regions of the body. And you expect that this region will be thick-walled and of course bigger because this movement is moving against gravity. You can see the way the aorta is directed upward, and also the pulmonary artery is also directed upward. So this region needs to be big and also muscular so as to be able to execute the function of pumping blood out of it to supply either the lungs or supply the different organs in the body. And that is why you see that the ventricle is bigger, is thick-walled, and also is more muscular. And if you try to compare the difference between the right and the left ventricle, you see that the left ventricle appears to be thicker than the right ventricle. And this can also be justified because on the right side, we already said that deoxygenated blood is being pumped through the pulmonary artery to the lungs. It's just a one direct pathway to the lungs where the blood will be oxygenated. But if you look at the left ventricle, you see that it pumps blood through the aorta. And of course, the aorta will supply all body structures or organs with oxygen and nutrients. So this needs to be more muscular than this. The right ventricle is supplying just one organ just for it to be oxygenated, while the left ventricle is supplying the different organs in the body. So you expect that the left ventricle will be more muscular because it has more work and also more organs to feed. So this is the right ventricle and this is the left ventricle. And from this presentation or image, you can see that the left ventricle is thicker and bigger than the right ventricle. So let's drive in further. The heart is further subdivided into 4 chambers. There's an initial division of the heart into the right and the left region by the septum. This is the septum. The septum is also further subdivided into 2. We have the interatrial septum and we have the interventricular septum. The interatrial septum is up here between the 2 atria, and the interventricular septum is between the 2 ventricles. But this alignment of septum that is formed to divide the heart into the right and the left part is aimed at separating oxygenated blood from deoxygenated blood. We already established that on the right side, we have deoxygenated blood, and the left side, we have oxygenated blood. So as to prevent the mixing of these 2 blood, we have a partitioning at the median side of the heart, which tends to separate it into the right deoxygenated part and the left oxygenated part. There is further division of this heart into 4 chambers. On the right side, there is a further subdivision by the tricuspid valve. This is the tricuspid valve that tends to separate the right part into 2. So we have the upper right atrium and the lower right ventricle. And also on the left side is also further subdivided into 2 by the bicuspid valve or the mitral valve. This valve separates the left side of the heart into the upper left atrium and also the lower left ventricle. So that is how the heart is further subdivided into 4 chambers. So we have the tricuspid valve and also the bicuspid valve. These 2 valves help to prevent backflow of blood. When deoxygenated blood is emptied into the right atrium through the vena cava, it is pushed down into the right ventricle. The tricuspid valve prevents the backflow of blood during the contraction of the right ventricle when blood is needed to be released through the pulmonary artery, because this right ventricle will need to contract for it to push blood out of it into the pulmonary artery. So the tricuspid valve will be closed up, and this will prevent the backflow of blood into the right atrium. Apart from helping to partition the heart, they also help to direct the path through which the blood will flow and also help to prevent the backflow of blood. So blood is prevented from flowing back into the right atrium as it is not needed here. It is needed to be pushed into the pulmonary artery where it will further be directed into the lungs where it will be oxygenated. Also on the left side, we have the bicuspid valve or the mitral valve. This valve also helps to partition or further subdivide the left side of the heart into the upper left atrium and also the lower left ventricle. Apart from this, it also helps to direct the path of blood and also prevent its backflow from the left ventricle into the left atrium. So that when the contraction of the left ventricle occurs, blood will be pushed into the aorta, where it will be used to supply the different organs in the body with oxygen and nutrients. It's also important for us to establish that valves are also seen at the emergence of the pulmonary artery and also the aorta. If you look at the pulmonary artery, this is the pulmonary artery that carries deoxygenated blood to the lungs where it will be oxygenated. There's also a valve that helps to prevent backflow of blood so that when the right ventricle contracts, the blood will be pushed into the pulmonary artery and will be prevented from flowing backward into the right ventricle. Also in the aorta, we also have valves at the emergence of the aorta. We already know that in the left ventricle, we have oxygenated blood that is ready to supply the different organs in the body. So as the left ventricle also contracts and pushes the blood into the aorta, this valve also will close up to prevent backflow of blood into the left ventricle. The valves are not only seen at the junction between the right atrium and the right ventricle, and also the left atrium and the left ventricle. They're also seen around the emergence of the pulmonary artery and also the aorta. All in all, what they do is to help prevent backflow of blood. So we have the aortic valve also at the emergence of the aorta, and this is what is highlighted in black. So establishing the valves that we have in the heart, we say that we have structurally, we have 4 valves in the heart, and this basically ensure that blood flows in one direction. So we have the tricuspid valve, which is seen between the right atrium and the right ventricle. And this is where the tricuspid valve is seen. This is a 3-leaflet type of valve, and it is seen as a demarcation between the right atrium and the right ventricle. So this is where the tricuspid valve is seen. Also, we have the bicuspid valve or the mitral valve. This valve is seen between the left atrium and the left ventricle. This is a 2-leaflet type of valve. So it has 2 leaflets in terms of its configuration. And this is the bicuspid valve or the mitral valve. And of course, it's seen to demarcate the left region of the heart into the upper left atrium and also the lower left ventricle. Also, it helps to prevent the backflow of blood. Then we have the pulmonary valve. This is the pulmonary valve that is seen at the emergence of the pulmonary artery, and it is seen between the right ventricle and also the pulmonary artery. Then we have the aortic valve. This is the aortic valve that is seen at the emergence of the aorta, and of course seen between the left ventricle and also the aorta. And we already established the functions that they exhibit. So going further, let's look at the structures that are associated with the tricuspid and the bicuspid valve. This will be very interesting as we unfold this. We know that these 2 valves help to further demarcate the heart or divide the heart into 4 chambers. We have the right atrium, we have the right ventricle, we have the left atrium, and we have the left ventricle. So this is how the heart is subdivided into 4 regions. The heart generally, having been configured into 4 chambers, we know that the right side and the left side are divided by the septum. So we have the interatrial septum that separates the atria. Then we have the interventricular septum that separates the ventricular region of the heart. This septum runs across the heart, dividing it into the right part and the left part. And if you look at the right part, you see that the upper and the lower region are further subdivided or demarcated by the tricuspid valve. And also the left side is further subdivided into the upper region and the lower region by the bicuspid valve. If you look at these valves, they are structurally held in place by some structures. And these structures, of course, helps to modulate or support the actions that they exhibit. So let's see how this is presented. We have a structure that is called the cordia tendineae. This is the cordia tendineae. This is like an inelastic cord or fibrous tissue that is seen to connect the tricuspid valve with the papillary muscle. This is the papillary muscle in the ventricle. The papillary muscle are muscular projections that are seen within the ventricles. And these papillary muscles are only seen within the ventricles. And you see why this is so. We have the tricuspid valve. This valve is connected with the cordia tendineae, which is a tendinous structure. And this structure is inelastic and it is held in place or tapered down by the papillary muscle. So the papillary muscle is like a structure that is helping to hold the cordia tendineae in place. It's helping to hold it or taping it down to the heart. And the region where you see the cordia tendineae, because these valves are opened inward, it's only in the ventricular region. So you have the papillary muscle in the ventricles, which are muscular projection. So that is the way they are presented. But let's further dive in to see the functions of this establishment. It helps to prevent the valve from opening when there's contraction of the ventricle. Remember, we said that the ventricle will contract so as to release blood either through the pulmonary artery or the aorta, depending on the region where they are located. So as they contract, this arrangement helps to prevent the backflow of blood because it helps to hold or keep tricuspid valve closed as they are being tapered or held in place by the papillary muscle. It also helps to reduce the impact of blood flow. When blood flows from the atrium to the ventricle on both sides, so it helps to control or guide the process so that blood is emptied from the atrium to the ventricle in a controlled pattern. So you can see that this establishment has its own function. So let's look at this clinical anatomy. We have cardiac arrest. Cardiac arrest is a serious health condition and it occurs when the heart stops beating. So when it stops pumping blood out, this is referred to cardiac arrest. And we know that when blood is not being pumped out, body tissues will not be filled with oxygen and nutrients, most especially the brain tissue that is responsible for controlling activities of whole body structure. And this can lead to sudden loss of life. We also have myocardial infarction. This occurs when the heart muscle does not get enough blood supply, and this can be attributed to blockage of the vessels. The symptoms of this include tightness, pain in the chest, fatigue, abnormal heartbeat, and anxiety. And basic treatments include lifetime changes, medication, surgery, which include angioplasty, which is a process by which the substance that is responsible for blocking the vessels will be removed, or bypass surgery can also be done to rescue the situation. Let's look at this brain drill. The first question is to justify why the left ventricle is thicker than the right. This we've explained during the course of this lecture. Also describe the pathway for the oxygenation of blood. We know that on the right side of the heart, we have deoxygenated blood. And where does this blood run to for it to be oxygenated? This we've also established during the course of this lecture. And the last question is to highlight the valves in the heart and also their functions. So thanks for watching. Let's meet again.